Come in. Good morning, Miss Wong. How are you feeling today?
I'm feeling good today, doctor.
Okay, so do you know why are you here today?
I think I'm here to change to a new medicine for my mental illness,
Do you know what kind of mental illness do you have?
schizophrenia.
Schizophrenia. Miss Wong is a known case of mental illness since 2015, and she had one previous psychiatric hospitalization. Miss Wong was in her usual health condition until 6 years ago, which is in 2014. She was fired as a secretary in a company due to her unsatisfied working ability. According to the patient, after being unemployed, she was in disbelief and isolated herself by locking up herself in her room. Around 1 year later, she claimed that she started to hear voices that could not be heard by others. She described the voices as clear, originating from external source, and appeared while she was fully conscious every day. She identified them as human voices, alternating with males and females. She was unfamiliar with all the voices, and the voices initially were running commentary and then became commanding in nature as they would ask her to harm or kill her family members. She claimed that the voices appeared spontaneously with no specific time and she had no control over them. Other than that, she also had a constant feeling of other people reading her mind. Her conditions were noticed by her parents as well as her siblings, and they brought her to the hospital. She was then admitted and was diagnosed with schizophrenia. Have you taken any other drugs, any antipsychotics for your schizophrenia?
I took haloperidol first. After that, my doctor changed it to risperidone. I've been taking risperidone for 3 months already. So now doctor referred me here for changing my drugs to Clozapine.
Alright, so can you tell me what you know about Clozapine?
I know this drug is for those who fail to classical antipsychotic, and this drug carries a high side effect burden.
Okay, good. So I've seen you have done your research. So yes, what you said is right. And the treat name of Clozapine in Malaysia, we normally use Fazaklo. It is used to treat schizophrenia, bipolar disorders, and Parkinson's disease. And in your case, it is used to treat resistant schizophrenia. In Miss Wong's case, she has treatment-resistant schizophrenia. The definition of treatment-resistant schizophrenia denotes patients with schizophrenia who, despite at least 2 adequate trials of classical neuroleptic drugs, have persistent negative symptoms. It is used when other antipsychotics have failed, like in your case. And so this Clozapine, it acts on the chemicals in your brain that is called dopamine. This dopamine actually involves in how we feel. So this drug is useful in treating schizophrenia. So extra information about Clozapine. They are second-generation antipsychotic drugs, also known as atypical antipsychotics. They have fewer extrapyramidal symptoms compared to the first-generation agents, but are associated with a higher risk of metabolic side effects such as diabetes, hypercholesterolemia, and weight gain. So for the mechanism of action for Clozapine, Clozapine blocks both D2 receptors as well as serotonin receptors. Because serotonin inhibits dopamine release, agents that block serotonin receptors may increase dopamine levels in brain areas that need it. Furthermore, atypicals occupy D2 receptors transiently and dissociate quickly, allowing for relatively normal dopamine neurotransmission. The modest D2 receptor blockage in combination with serotonin receptor blockage is thought to significantly lower the incidence of extrapyramidal side effects, as well as decrease negative symptoms and improve cognition compared to typical agents.
I see, doctor.
Okay, so before you were diagnosed with schizophrenia, what kind of symptoms did you have?
I can hear voice that commenting on my appearance and actions, and the voice appears spontaneously and I had no control over them. Besides, when I talk with people, I think they can read my mind, and this affects me a lot. And I also get angry and easily with no apparent reasons.
Okay, I see. So the voices that you hear in your mind is called hallucinations, and the thought of you thinking that other people can read your mind, this is called delusions. And of course, you have extreme mood swings, and this clozapine, this drug, is used to prevent these symptoms from occurring.
I see, doctor.
So this is clozapine. It is 12.5 milligram. You just need to take twice daily, one in the morning, one at night. Make sure you take them around the same time each day. And this is a dissolvable pill, so make sure when you take out the pill, right, your hands are dry. And then you just put it on your thumb and let it dissolve by itself and swallow it with saliva. And if you miss your medication for 2 days in a row, please come back to me. And also, 2 weeks later, you have to come back so that I can prescribe you another dose of clozapine.
According to MIMS Malaysia, we should start clozapine at 12.5 mg 1 to 2 times on day 1, followed by 25 mg 1 to 2 times on day 2. After that, we may increase the dose in increments of 25 to 50 mg daily within 14 days to 21 days, up to 300 mg daily in divided doses. The usual dose for clozapine is 200 to 450 mg daily. However, the maximum dose is 900 milligrams daily.
Okay, doctor.
Alright, so now I would like to refer you to do some initial assessments, including a blood test, ECG tracing, blood pressure, and weight measurement.
Why I need to do this, doctor?
Because we need to see whether you are fit to use this drug or not, because the drug may cause some side effects, and we must have like a baseline investigation to see whether you are in a fit condition or not.
I see, doctor.
Okay, one more thing you must remember is you must attend weekly blood tests for the first 18 weeks and then every 2 weeks or 1 year.
Why?
Because this is to monitor your white blood cell levels, as clozapine may cause some neutropenic effect that is affecting your white blood cells. Yeah.
I see, doctor.
Okay. The antipsychotics that you have taken before, such as the haloperidol and risperidone, what kind of side effects do you have? Like what kind of symptoms do you have after taking the medication?
Sometimes I experience difficulty in passing motion, and also I had gained 5 kg in a month before.
Okay, so this clozapine is almost similar to other antipsychotics that you have taken before. The side effects are like constipation, dizziness, increased salivation, lethargy, restlessness, changes in blood sugar level, weight gain also, and in more rarer cases such as bone marrow suppression and also changes in heart function, but not to worry, you'll be fine.
Okay, doctor.
Okay, so are you taking any other medications other than antipsychotics for your schizophrenia, like maybe for your hypertension or diabetes mellitus?
No, doctor.
So are you considering pregnancy?
No, doctor, I'm still single.
I see, okay. Okay, so what you can do on the road to recovery is that you must eat healthily, exercise regularly, and avoid alcohol and caffeine, and also must drink a lot of water and have enough rest. And also for your constipation, try to eat more fibers. Try to add more fibers in your diet. Okay. So do you have any other questions?
How long it takes for me to recover from this illness?
Actually, it depends on each person. It differs. So what you can do is take your medication regularly and then keep a positive mind to this illness, and make sure you just eat healthily, exercise, and avoid all the negative stress in your life. Yeah, so I think you are doing quite well, and I'm sure you can recover pretty fast.
Okay, thank you, doctor.
Alright, thank you. Have a nice day and don't worry so much. Alright.